So we are going to start the second meeting of the Healthcare Industry Consortium. I was starting a little late. We need to start public comment at the time on the agenda. So before we go into introductions, and I think a few people are still trying to get in the building and up the stairs, I'm going to open it for public comment. I'm going to ask Roman, do we have any public comments? Okay, thank you. All right. So now we will officially go into introductions. So I'm going to ask the mic. I'm standing up. Okay. There we go. So welcome everyone. Thank you for traveling and finding your way into this building. I really appreciate it. I want to hand it over to the executive leadership team who's going to lead us through introductions and meeting objectives before we go into the agenda and study. So, Ryan.
Good morning, everyone. My name is Ryan. I'm the part of the co-chair of the Consortium, also part of the Governor's Racial Justice Council, chair of the Healthcare Committee. And today, please state your name, organization, and then a highlight of the summer. A fun fact, okay? Your biggest highlight of the summer. Whatever that is, we show it. Okay? So pass it on to.
Hi, I'm Melissa Unger. I'm the executive director of SBA Local 503. Welcome to our building. Sorry, it's complicated. And the highlight of my summer. Well, in my spare time, I'm also a small farmer. And so our business did a bunch of berry business this summer, and the highlight of my summer was working at farms and kids.
I'm Cheryl Cohen, she, her pronouns, and I'm the Provider Workforce Development Program Manager at Source Health Plans. And the highlight of my summer, I got married. Good morning, everybody. I'm Liz Rain. I'm at Oregon Department of Education. I'm the new CTE for Technical Education Health Science Specialist. I too got married this summer. Policy advisor for the Healthcare Industry Consortium. It's so wonderful to be here. The highlight of my school is not either getting married or anything like that. Unfortunately, went camping.
Hi, my name is Chris Marley. She would pronounce that move director. Highlight of my summer was spending 2 weeks in Germany with my husband and son. My son spent a year in Germany as a gap year, and we weren't left to visit him, and he couldn't come home, so I had to be taken around by our son, and it's now fluent in German. So it's
Hello, everyone. I'm Brian Berger, I'm the executive Oregon Medical Association. Summer, but I would say the highlight was spending a few days at the coast, reading and smelling the ocean and watching.
Hello, everyone. Sarah Lochner. I'm the Executive Director of the Coalition of Local Health Officials, Public Health Directors Association. Highlight of my summer would be a trip to Eastern Oregon, hiking, visiting Lake Wallowa, and getting sunburned. Don't tell my members.
Good morning, my name is Michelle Sanders. I'm the Senior Program Manager here for Rise and Long-Term Care Works. And I'm like you, I had a great summer, but one of the highlights would be that on the side, I'm a photographer. And so this year was my first time doing like a real photography gig. And a friend of mine and I did a big pop-up. Welcome to the Executive Director of All Science Community World Health, the Consortium of Medicaid Dental Health Plans, and the highlight of my summer, we can't eat too nice this summer.
Hi, I'm Gupta, Sheena Pronouns. I'm the Director, Clinical Supports Integration and Workforce at Oregon Health Authority. Highlight of my summer was that we used to have a really nice celebration of my father-in-law. He passed away after about a year and a half of battling cancer, but we're so lucky that he was here with us. He moved when he was moved to the US about 4 years ago and lived very, very close by. And we're very lucky that he passed peacefully at home and just so we're felt so blessed to have so much recognition in his life.
I'm the new director of the Oregon Office of Rural Health, and my highlight was time spent in South America.
Good morning, everyone. My name is Patsy Richards. I am the director of long-term care work statewide. I am excited to be here because I am back out seeing people faces, smiles, demeanor, body language. I just love being in person. But the highlight of my summer is my oldest son transitioned from Alabama here. So I'm really.
Hi, everybody, my name is Emily, I'm the executive director of the system. The highlight of my son was a couple days ago when I brought home a giant. But it's all why I'm busy.
Hi, everyone. I'm Rob Lane. I'm a professor at Western Oregon University. The highlight of our summer was probably a road trip down to Northern California and going to the Monterey Bay Aquarium while reading Cannery Row by Thomas.
Becky Holberg, I'm president of the Oregon Association of Hospitals and Health Systems. The highlight of my summer was my middle child, boy, graduated from college, is gainfully employed and got married.
WI's Oregon Business Council. My highlight was my to introduce my new son-in-law to my extended family out of lovely.
The highlight of my summer is that my very, very small 2-garden bed garden gave me so much produce this year. I was consistent over the just leaves you inside. I'm Janet, and I'm the executive director for the Oregon Center for Student University. The highlight of the summer is I got to go on a wonderful trip to Maui, where just this evening, sound like the ocean, ride the boats, really wanted to try and wander around all the beautiful things. Got on the plane as but I got really great souvenirs and places you can put on here.
Good morning, everyone. I'm Susan Kern. I'm the Learning Officer from Black Connecticut in Southern Oregon, and I'm here for summer celebrating our middle son's marriage and with our daughter-in-law and her mom. Jan Campbell, Oregon Health Leadership Council. Highlight of my summer, going to Boston with my kids and going to a Sheeran concert. And they let me go there.
I asked the question about someone. See, if you're very monster.
Hi, Dr. Edgar Lindsay, and highlight is that I did work as for July of this year. And we're many people who all in this world over 5% and going into the ball over 9%.
We're gonna go over the meeting objectives. So I want to just appreciate all the work that Sarah has put in and the staff have put into planning this meeting. And the executive team here has spent time trying to really dig into like how do we make these meetings move us forward with short-term objectives and our long-term objectives. And so this meeting, some of the things that we want to accomplish today is one, we really want to develop some shared understanding of how our work as a consortium will fit into the larger workforce and healthcare policies landscape. But I think sometimes there's just so much to do that like, what is the goal of this consortium? What do we get to do in that mix? And so we want to be able to do that. We did thank you to everyone who filled out the survey or forwarded the survey, but we have the initial results from the survey about what people's priorities are. We want to review that and get additional feedback as we think about how to use that survey to guide the next phase of this work for our consortium. And then we have the short-term objective that we have to do is make sure that we're guiding these grants in the timeline for this program of grants for the Future Ready Oregon. And so we need to provide that guidance. At the same time, we get to hear some information from current grantees, so that it helps us think about how and that fits into the landscape. So those are the goals we have. I think we're going to continue to try to balance the short-term objectives of these grants and our long-term work of trying to work with the workforce for the health industry.
I think if Dr. Billings, Janet, if you want to make any additional comments as we open the meeting.
I want to just comment on a little on this work, and I think it's always good to ground. I know it's in the foundation of our why. It's beyond ourselves. So when we think about this work that's ahead of us, we think about the impact on not individuals and families, but also in work systems and work cultures, ways of work, also diversification, and how do we show that? And it's this holistic ecosystem of transformation that further collaborative thought partners like each of you in this space. I had a beautiful opportunity of being in DC over the past couple of days, just advocating to associate commerce, education, labor, and just really putting the miles on my tennis shoe. But it's so important that our work does not just start and stop in this space, but it expands across the state and our respective agencies to. But also at the national level, I do believe that this work will serve. When we continue to do all this, it will continue to serve as a model and as it can be replicated in terms of this is what collaboration looks like for our communities in the areas that we serve.
I think the appreciation I have is everyone is willing to be in on something that's really complex. And I think about how we all got here. Some of you came down Siri, some of you ended up in the bank, some of you came here, but we eventually got here. And I think there's many ways to slice this pie. We all have an opinion about how to solve this problem, but I think we need to lean in and do what's right by our workforce, and also lean in and figure out what are the most optimal solutions to move this big elephant forward. Thank you, and I had the pleasure of working over the summer with like a rock star executive leadership team. So just appreciate your leadership in this space because it is really complex and it is really big and gnarly. And just kudos to the executive team for sticking with it as we start to really define our lane and advance our short-term objectives. So with that, I'm gonna move us along and just give a brief overview of the agenda today. So we're going to do a quick healthcare workforce policy landscape. Unfortunately, Rachel Kearns was in an accident last night and is unable to attend today. So I have her remarks here, but I just want to remind us all to slow down and take time. As someone who also drives to Salem a lot and is commuting, and I know many of us are in our cars all the time, just taking that time to extra time to slow down and yeah, just thinking of Rachel today. So we're going to do that. We'll share some of the remarks that the governor's office is going to make around, in particular, the value that this group can add to this really complex problem. Then we're going to move into data refresher. So Gail's is teed up to do some refresher on the data and think about how we might think about demand, not just in the short term, but out in the long term. And then go through the survey results. We'll do a small group discussion before we break on provide input on both some of the data conversations and the survey results. And then we're going to get right into the rest of the day advancing our short-term objectives, which is to advise on the Future Ready Oregon workforce funding. So the bulk of that will really be learning from future Oregon grantees, current grantees in a panel discussion, and then we're going to go into a longer, smaller discussion. That's really going to help us elevate some additional criteria to consider, start to prioritize. We're not making any decisions today, but we're really going to be providing guidance to the funding working group that I'll share a little more about over the fall, and then we'll wrap up and hopefully you'll stay for because I know that, this is a space that we have met. It's our third time, I think, meeting, and many folks haven't worked together before. And so just spending some time with each other, getting to know each other, I think can only help us advance our journeys. So with that, I'm going to we already opened it for public comment. So can I just have a motion? I sent the meeting minutes from the last meeting. Can I have a motion to approve those meeting minutes? So great. Thank you. Second.
No,
There's lots of motions to approve the meeting minutes. Appreciate that. And I'm going to move right. I put her over. This is fresh out of the box. So just wanted to level that. So again, as a reminder, I don't have to remind anyone of this, but this is a complex problem that we're working in our healthcare workforce, and many folks at the table span occupations, span industries, span just the ecosystem of our healthcare workforce. And we need to start somewhere. We need to start to prioritize, and that's all in the context of both workforce policy and healthcare policy. Which is, I think, a little different from some of the other sectors that industry consortia are convening. This is just different in terms of the intersections between health policy. Just want to name that and acknowledge that, and acknowledge maybe that's when we started first. I don't know if we're guinea pigs, but it's just going to take us a little bit to wrap our heads around this larger ecosystem that we're swimming, or this is the water that we're swimming in. So I will give Rachel's remarks. It's not Rachel, but I'm going to share a little bit from the governor's office perspective of what's in scope of this healthcare consortia and what is out of scope. Just as we move through the day, thinking about our objectives and thinking about what's in our kind of sphere of influence and things that the governor's office think would provide value to this broader ecosystem. So the first bullet is overall the consortia should focus on working directly with industry on demand planning and pipeline development focused on equity, stronger and clear connections with higher education institutions and training, and career value development. Also for the thematic, equity is schooling me, but that's really our project. Specifically, the healthcare industry consortia should consider direct investments in occupations like certified nursing assistants, peer support specialists, medical assistants, community health workers, and other non-licensed professionals that industry and employment data have identified as statewide shortages. So that's the second bullet. The third bullet is the intention of investments should be seed money that will support funding recommendations for the 25-27 and 27-29 biennium. We would like the healthcare industry consortia to evaluate and recommend successful models for expansion and drawing down of Medicaid matching funds. The fourth bullet, please focus investment in supporting navigation, developing clear pipeline and direct care and behavioral health workforce. Intentional development of clear career laddering opportunities into licensed and connecting credentialed professionals to higher education campus. And then the third, whatever bullets, no certification, training, or apprenticeships should be a dead end for career advancement. So really focusing the efforts that connect healthcare workers to training and education and ensure credit for learning is accepted across institutions. So those are the 5 bullets that the governor's office really thought that we can add value to the larger ecosystem of healthcare workforce. Well, without a scope, monetary, technical, administrative policy barriers analysis will not be led by us, but will be led by the Health Authority and the Health Policy Board, in particular around the behavioral health administrative barriers task force. that should be the focus of our work. That's very specific, but just thinking about the intersection between health policy and workforce policy. We really live within the workforce space, certainly aligned and connected to health policy. The second out of scope bullet is creation of care delivery models. And the third is around provider ratings. So I think that just to lead with what's in scope, I think really in the short term, thinking about how we get more folks in the entry, non-licensed, short-term credential positions, and then in the medium term, think about career ladder opportunities for those positions, and that expands across occupations. And then what out of scope really is direct health policy. So I think that really helps us stay kind of clearly in the lane of education and pathways, really centering the needs of priority populations that are called out in futurity Oregon legislation. So really centering equity, and you heard from Brianne in June, if you're at that meeting, around the equity lens and how we think about how that guides us work. But that those short-term opportunities, we, I think seeing a gap in that once you get folks into those short-term credentials, they should be locked into those opportunities. We should be really intentional about career advancement and the barriers to career advancement and centering the needs of those populations when we think about career advancement and career ladder opportunities or next opportunities. So with that shorter, we're going to move along, but I'm going to give it to the executive team to make some comments before I move along. And Melissa is raising her hand. Yeah, I will. Yeah, okay. If there's any other comments, I'm going to move this along, but I will send this out to the group with the notes. Okay. As they receive it this morning. Bear with me, this is going to happen all. Yep. So I'm going to tee this conversation up a second, and then microphone over there. That's yeah. Well, I keep stuff. So I just wanted to level set a little bit on some of the data conversations that we had in the first kickoff meeting, because I think that I received over the last 6 months some feedback on the data, some questions on the data. How are we using the data to advance our both short and long-term objectives? How are we grounding this consortium work in data-driven responses? So the first kickoff meeting, you heard kind of 3 data presentations, and one was Gail talked a little bit about healthcare trends in Oregon with the labor market data, and the second presentation was the Oregon Longitudinal Data Collaborative that really took some of the labor market data and then did some deeper analysis and really looked at shortages in terms of graduates from nursing programs. And really did some measurement and analysis around the education and training pathway as it relates specifically to one. And then the health authority, they shared their presentation that was really focused on population health and health policy and how we think about workforce in that context. So wanted to do some level setting around just the labor market data. So what does it tell us in terms of healthcare shortages? I've also gotten some feedback around, well, we keep trying to solve for these shortages, but how do we think long term? Like, how do we know our investments are making a difference in the long term? How do we think about demand in the long term? So just wanted to have you, I know when I do 3 different presentations with the same data that it takes me a while to understand what each presentation is telling me. So I thought we would just do a really brief refresher on the labor market data before I dive into the survey results. So yeah.
It is, but you need to do that, like, this is connected to. Which one that Sarah had?
Okay, hold on, we'll do a little bit of.
Alright. Okay, good morning, hello, and thanks for coming back to the chat very briefly. Again, just about kind of
where we moved in the last handful of months in terms of healthcare trends and and then I know the first time that I presented to this group, my ask was general overview of what's happening. So did general overview of what's happening, and then in terms of this time around, really starting to think about how to make comparisons in demand across different applications within healthcare. So I'm going to be quick, but I think it's also one layer deeper into that. So I'm going to move on to the next slide. I'm going to fly through these first few slides just to tell you that pretty much things are the same as they were a handful of months ago. Oregon's unemployment rate was 3.4% in July and August, which matches its all-time record low going back to at least 1976. So a very low unemployment in Oregon. One thing I would stack on top of that, which is a concern when you're trying to fill vacant positions, is that we've also seen, well, first of all, that there's about one unemployed person for every job opening that's out there right now, which if you could assume that there was a perfect geographical and industry application interest match there, then that would be so much of a thing, but that's not what works. And so this in a recession time, you would see something more like 500, 600 people per job opening, and right now it's very difficult for employers to find local workers that they need just in general. So I'll say that, and the other thing is that in recent months we've seen between January and August, the size of Oregon was defined by more than 40,000 people, which is about 1.9%. That's not so in a labor force of 2.1 million people, that's not a gigantic exodus from Oregon's labor force. It's also not an increase. So something that I'm keeping an eye on. As we switch to the next one. So another thing particularly relevant here is that over the past, so Oregon actually lost 1,200 jobs from non-farm payrolls in August. But over the past year has added about 26,100 jobs. And the majority of those have been in private health care institutions, which have added 14,000 jobs in the past 12 months. And we're in this kind of phase become where that's not true for all industries. Some are no longer adding jobs in the past year after a couple of years of rapid growth, where most industries were in recovery mode. All right, switching to the next one. One layer deeper in healthcare, and you've seen this before, but just an update again. Just because healthcare has added the most jobs of any broad sector in the past 12 months, did not mean that that happened equally within healthcare either. So once you're back above this line right here, you have more jobs than you did before the last recession. So that's true for doctors, especially with composted local care, which now has 3,100 jobs more than it did in February 2020. Hospitals are just a couple hundred jobs away from where they were. These are, again, we talked about this the first time, jobs on their payrolls. So like Houston, cafeteria or special care services or something like that. But on the payroll, and then nursing residential facilities is really starting to see the recovery happen since the Latin Quarter 2022, but still almost 2,000 jobs. I showed you this before, so I'm really not going to dwell on it because we're going to talk about it in more detail at the end here. But still true, even if all of the parts of healthcare had already fully recovered or where they were before, I'm not saying that meets all of the need that employers have for businesses, nor does it necessarily meet all of the need that's out there for healthcare services, right? So I'm not saying that at all. I'm trying to temper, it sounds like good news, but where everybody else wants to be. So private healthcare, especially all healthcare, really tend to be job growth in the short term and in the long term, with the exception of 2021 and 2022. And really, in addition to having the most growth, typically urban among the largest growing sectors, also consistently have the largest number of job vacancies and their Oregon. So have a quick look at what they looked like in 2022, and the top few, and I mentioned before, the top few occupations that tend to always have the largest number of job openings for some areas, that true and consistent for pretty much the entirety of the time that we've done this, since 2013. Again, so as we move on to that, I think we've got the harder to get that on the last slide here. So to kind of take another look at not just the big occupations, but overall the employee department. We do employment projections and for more than 800 different occupations in Oregon. And so we have multiple measures and ways that we're looking at the end of short term and long term. So in general overview, I was just kind of saying like in 2022, here's what we're looking for now. There's a little guide here that you probably can't see. So I'll just tell you the full dot there on the front, that means that that occupation is within the top 5% of all occupations in terms of the number of job vacancies at any given time in 2022. If you move down, that's like a score of 5. From a 5 to a 4 is the next 10%. So you would be in the top 15% if you're here. And then this one right here is the next 10%, or sorry, next 15% after that. So anything that gets one of these 3 things is then the top third of all occupations in terms of demand. Is that right? Hopefully, anybody stop me if that doesn't make sense. I know I'm trying to stick to my time. So anything that's from here, so this, or sorry, from radiology technologists and technicians, top third of all occupations in Oregon for job vacancies in 2022. Also, who's in the top third for the number of online job ads just released in 2023. There's some consistency and some different ones that come up, right? And then I'm also looking at long-term 10 years, which ones still come up in terms of the total number, not just new jobs that are created, but also replacement jobs to replace those workers who are retiring in the next 10 years, who falls in the top third there as well. And to adjust for the size of the smaller occupations that don't leave them behind, I'm also looking at over the 10 years, those total job openings, how big is that relative to the size of the occupations? So if we only have 1,000 of these, but they have 10,000 openings, you know, as opposed to registered nurses, that's the occupation. So yes, it's the total openings. But you can see, for example, that it's smaller in terms of its overall size of the occupation. This is bigger. So I'm trying to offset that. And so you can see physical therapists and it's popped up relative to the size where it didn't pop these other things, right? So I don't want to break this down and you know, like hyperanalyze it right now. I'm taking questions about it, but what I wanted to do was set everybody up to have something a little bit more detailed to look at as we're thinking about how do you compare occupations. So it doesn't matter, you know, if the number is 5,000 or 6,000, but how does this compare? And then it's just within the healthcare field. How do these things compare? Who consistently comes up again and again and again at the very top of the pyramid, right? You know, so if that's a way to help maybe inform comparison of things, and of course regionally it'll be different, and that's where everybody's expertise in brain power comes in, especially because needs are different, you know, in Eastern Oregon and South Coast and down in Portland, right? But just overall from a statewide view, I'm hoping it's a little more comprehensive to see the things that kind of comes to again and again in terms of short-term and long-term.
So on the registered nurse, that one sticks out because you've got a black on the longer term. What is that? How would you interpret that?
That means that even though there's a lot of job openings for registered nurses, last year, there's a lot of job openings for registered nurses now. There's a whole bunch of total openings for registered nurses over the next 10 years. Is that it's already a really big occupation. So 4,000 job openings or whatever it is for registered nurses, smaller part of its total side, then like 4,000 job openings would be for this smaller occupation. So I'm trying to correct for the size of the occupation itself. So if you're a smaller occupation, but you've got the same number of openings as a bigger one, then that means that like relative to the size of the application, the need is really strong. Yes.
Question on the mental health counselor one. That did you include, because we talked about earlier, credentialed professionals?
Mm-hmm.
So there's quite a, does everybody, is that include licensed, qualified mental health professionals with masters, peers, alcohol and drug counselors? So you lump them all into just one?
Yeah, that's right. I have the way to differentiate, you know, you do just by which occupation is that would be any certification that already that occupation all combined.
Thank you.
Yeah, there is like the information that other agencies work on. That you know, we can bubble specifically that space, but we
Okay, well, I know macro.
Can you just remind where do the categories come from? How do we get these jobs on the board?
Oh, so when I so it started out as like a pure data exercise, like here's 800 occupations, which would have and then sort. biggest number of job openings to the smallest. And then after that, I'm like, okay, which ones are in healthcare? Either the practitioners or the support workers. So it's just those, not because there aren't cafeteria workers and, janitorial staff and all that other stuff, but I'm looking just for this, the ones versus it would be in either the healthcare practitioners or the healthcare support work occupations to try and get more specific to this focus. So it's our just a data exercise on every single one of these. It's every single, all 800 occupations, with the exception of this one, which is side of healthcare, and then top bottom, who's got those things. And then from there you say, all right, what's using the top 5% of all, who's the next 10, who's the next 15.
So this is the employer.
No,
So
It's
I'm
really-
just like, how do we, sorry, how? It's just like, where do the numbers come?
so we survey employers every quarter, private employers every quarter. And we ask them what jobs are you trying to actually go right now, how many, that kind of stuff, and they answer it. This one is online job ads, so that's just job boards, so this captures something different, like a lot of construction companies and mom and pop restaurants don't do this, but they do this. So, but healthcare tends to be better at it, so this is online job ads. This is, employers have to report their records to us, tell us how you were on the payroll. And then, so these are, we want to fill these are, we want to fill these are people that work these jobs. And this is employers telling us with their own records and supplementing and self-employment data, who works in these types of jobs right now and projecting that out. Using global forecasting, projecting out the next 10 years and saying what that is in terms of things that this companies and adding the demographics, how many people do you are going to be in that occupation, what's the average amount of time we spend in talking doctor or something like that. And that helps, and demographics of who's that you can prefer. And that helps us figure out like what the likely produce numbers that may be. So it's multiple sources coming together. Yeah. Sorry, I'm moving my.
Well, no, you're fine. So I'm gonna have Janet ask your question, and then we're gonna go to the survey. You're gonna have time to unpack this in your table discussions, because I know this is a new way to look at the data, and I know this is gonna reveal a lot of questions, but I think the point that I want to make is just because I've heard a lot of feedback like, well, how do we demand plan? How do we, solve for unmet need? How do we, like, what is the data that we're using to guide our decisions? And I just want to share, our data is not perfect, and that should not limit our ability to make some progress and move forward with what we do know. So just because our data isn't perfect doesn't mean we don't know anything. And in the long term, this is an opportunity for the consortia to think about how we want to use data in the long term. So I'm trying to see the conversation like, what do we know now? And then how do we want to think about data in the long term, knowing that we don't have a perfect data set. And many of you in the room have expertise and can contribute to these data sets in the long term. So this isn't a final data set, it's just a way to think about longer term projections than I think the initial shortage that we shared in the first meeting. So Janet.
Just the mental health counselor one is quite, it has an anomaly. It's the only one without projections. There's nothing online, there's nothing, did you have any insights as to?
So it's
Because the mental health counseling one has no additional.
yeah, let me double check here. I think it means that for me that it just doesn't rise to the top. Let me double check and just make sure that it's that there is something that's missing on it. But there's a couple of them that are like this as well. And I
It's
think
the only one with no one that does.
yeah, well, health technology is the same thing too. So I'll double check this and I'll get back to you and answer. But I think in the short term, the answer is that it doesn't rise to the top. And that compared again, not that there's not a tremendous amount of need there or that it's all met, but that when I'm pitting 800 operations against each other, is it in the top? Yeah, so not to say that there's need everywhere. I'm not saying that there's like less deserving or uneven or not important occupations. I'm just saying you pit these 800 against each other. Here's what comes to the top. But I'll double check it just to be sure.
Yes. That's why I asked the question earlier that I asked, because I think if you bulk them all together, like in our membership, we have technically agencies, they employ between 8,000 and 10,000 people statewide. And because it's all lumped in one, you're not gonna capture the nuances of licensed mental health out of that 10,000 people, qualified mental health professionals out of that 10,000 people, alcohol drug counselors out of that 10,000 people. So, but we can get that kind of data. It is good enough accessible so that we can understand what the buckets are. That was my thinking when we were talking about it, because it's such a small group of professionals, but there are very specific subsets that are credentialed and licensed in that bucket. Does that, and then also I was curious about, and I'll ask you offline, about who all responded. Because we have salary survey data and things like that, so it's.
So the first two is gonna be exhausted, the last two is like 95% off.
Thank you. We will, I just want to see this conversation long term because the data, I get thinking about this, like the closer you try to measure things, the more complex it becomes. You know, drop a Fibonacci joke in the meeting, but that is what we're dealing with. And with the vastness of the healthcare space and the credentialing and the license, like this is just very complex in how we measure it. But I wanted to think about this as we think about, especially I heard feedback at the first or the second meeting that we needed to think about how our investments were going to see longer term solutions in our healthcare workforce. So not just solving for current crisis and shortage, but thinking about how we're building a workforce for the long term. So I know that our data set is imperfect, but wanted to give a little bit of insight into some ways that we can project and we can think about demand with the labor market data that we do have. So I'm going to move us into a conversation or just a short presentation on what we found in the survey. So here's the data, and then I sent out a survey that asked a number of questions. The first is, what are the highest priority healthcare workforce development needs? The second was, what specific workforce development priorities or strategies has the organization identified to advance the diverse workforce? The third was, what are the policy barriers that impact their ability to move these priorities forward? And then the fourth was, so what are the priorities or strategies that can be advanced with funding? So I wanted to share the initial results of this survey that was really helping get kind of a pulse on where the consortium was at in terms of shared priorities and alignment as we move into our short-term discussion today. I'm going to go through the whole kind of just 3 slides that show short, medium, and long term, but and then we'll have time in small groups because I just wanted to give a snapshot first that we responded. So as you can see in the purple blue, however you see color, is the dark on the left is the bulk of our responses. I'd say the majority were education and training providers. This includes community colleges I read. We had some industry associations, community-based organizations, and state agents representatives. So I'd say keep this in mind when you see the survey result. And some of the questions I have in a small group is, how do we get engagement in some of these areas that aren't equally represented in this chart? So just keep that in mind as I'm going through the survey results. I'm not calling them themes or results at this point in time. They are initial insights for anyone that didn't fill out the survey. But there's time at the end to provide feedback, and then we'll think about, as we move through the process in the fall, how we want to get intentional feedback and deeper feedback from some of those buckets. So in the short term, and this is and I'm going to organize this in terms of our short-term objectives as a consortia, and then our medium-term objectives as a consortia. So in the short term, we're advancing workforce ready grant funding recommendations. And so the key insight from the survey was there was a general sense that we needed to have recruitment and training for entry-level, non-licensed, and short-term credentialed applications. Really getting more people into that pipeline of short-term credentialed occupations and non-licensed occupations. So that was the key insight from the survey, and it is reflected in some of the funding gaps that we're seeing in the ecosystem. Both from, provider incentive programs that don't necessarily incent some of those non-licensed professionals, but also just generally in the ecosystem, not a ton of funding is directed at this. So the first bullet is marketing and awareness projects that support the flow of diverse students, workers, into entry-level positions. Publicly specific and responsive curriculum design, earn and learn opportunities for entry and mid-level positions, ongoing funding for partnerships between education and training providers, businesses, and community-based organizations, and high school pipeline and apprenticeship opportunities. These are really broad themes, but these were generally some of the insights from what could be advanced in terms of funding in the short term. And you will have time to unpack this at your small groups. So in the medium term, the insight is really to support the career laddering and advancement from those entry-level non-licensed credentials to licensed career professions. So in the medium term, exploring work to learn credentialing positions with career ladder and diverse education experiences, a centralized placement system for multiple occupations, including nursing, behavioral health, and public health, so those clinical placements. Community college pathways and credential applications, pathways for credential and certification level employees in high need areas, and then additional rates of needs assessment of the current education and training assets for credential occupations outside of their state. You heard in the first kickoff meeting of laser focus on kind of the nursing pathway, so there was some need for additional research and additional education and training assets on the outside. And then just in the long term, I pulled these quotes out to represent some of the perspectives in the consortia that I think that others responded in the survey to, but I thought these quotes were really insightful. The first being current data systems measure point and time shortages at the state level. So we need to better understand how to develop a data system that can support demand planning at the local level. So I think you've heard from Gail that our data is imperfect. It measures the point and time shortage. You heard a little bit how you might project those shortages out over a longer time period, but that doesn't give us as much insight as we would like as a community to think about how to do local level demand planning. The second is big. Existing and regulation barriers will emerge as we work on these career recruitment and advancement strategies. So this consortium needs to elevate these barriers and develop a plan to address them. And then we need new higher education models that reward collaboration and statewide coordination for our healthcare workforce and for competition. So I thought that these quotes were really insightful as we think about the long-term role of the consortia, in particular around data, in particular around some of the policy barriers that are going to emerge as we get into this work. And then in our education and training pathway phase, like how do we actually advance some of this work? So I am going to you're going to actually break out in your like you're all either in twos or threes at a table. So just turn to your partner if you don't have one. Again, maybe come join Heather and Becky over here, but just really reflect on the conversation of the data. I would say reflect on the three conversations or the three presentations. One was some of the lane in which the governor's office really thought that we can provide value as a consortia. The second is some of the data, you have the slides in your packet, the data presentation that Gail just gave, and then the third is around the survey results. I just say you have about 10 to 15 minutes to talk with your small groups and reflect on these questions. So what resonates and what's missing? How can we in particular get additional input from healthcare employers? They were one of the smaller groups that were represented in the survey. So that's why the survey results aren't final, but how do we get additional input from healthcare employers? And then the third is who else should we intentionally engage and get feedback from? So I am going to stop and then we'll come back as a larger group and have time for just questions and discussion before we move into the next part of the Go back to the question.
I think I judged in that next, but I think, very far away.
Okay, so I think that we're going to, I love it. We could just do, I know that the data is a lot and there's a lot, and a lot that I heard, but I'd love for folks to, give maybe one or two takeaways from your conversation, in particular around the data and the presentations you've heard, but just like as we think about moving our short-term objectives forward, with some insights that we should be carrying forward with us for the rest of the day. So
look at my imperfect notes. I think demand planning came up as a central thing that we need to really focus on. How do we match the need, the demand in these high demand occupations from industry with the supply we have in education? How's that going to happen? Who's going to do it? Where's the money going to come from? All of those things I think are something to talk about. Input from industry resonated just because of the fight part. It's obvious to figure out the get some additional engagement. And then one thing we haven't really talked about, I don't really know if it's relevant to these slides, but I was mentioning anyway, was as we project forward and looking at an environment where we may have smaller workforce numbers going forward than we've had historically given demographics, how do we account for the need to use technology or to basically take care of the same number of people with a smaller workforce? And that may be something that we have to just potentially focus on and talk about.
thank you. Other groups want to share an insight?
So real quickly, we were talking when we talked about the data and also from the perspective shared earlier in meetings, we talked about the 3 C's. One really is, I'm not sure if we collectively across the state recognize that our current healthcare is in crisis, right? And we're talking about all these plans. So elevating it as a crisis is really critical. And elevating it as a crisis in this phase, we don't believe will accomplish much, but it has to come from the state level, just in the same token that the governor has elevated housing, homeless sensibility should be critical. So that's the question out there is like, how can we elevate that? Knowing that there's some complex political nuances around that outside of this space. What does that look like? But it is in crisis currently. We're doing all these short-term, there's short-term and long-term. There is an immediate need. And then the second one I'll let Marty talk about in terms of collaboration.
Sure, and I think one of the things that we're doing, we're all working together. I mean, we're working with CDOs, all your school districts, education, to fight the pandemic. That same model of collaboration, we could go back to that. We would help the crisis. And I feel like we'll do that again. I think we'll go back to our silos, back to our case, working in silos, the different kinds of partners. And that's not good for any three of us. Because every teacher maybe has an answer, and or maybe one this, even maybe have a written or this marking. So for us, collaboration is key. That's why part of our model is to reach reality is having employers, CBOs, higher education, everybody work together to a common goal. And that is being a platform, reaching that. And I think that then we learned that together we can fight crisis. If it's a crisis, I think that moving forward.
Thank you for the both of you. I think the other one was just, we see a lot of the community college representation. We don't see the higher education. We don't see UFP, we don't see Oregon State, we don't see UFO in terms of the partnerships to really solve the longer tail of the educational pathway. And I think we need more voices on that front. I think in regards to the demand planning we talked about, Becky, I just would agree. I think that when I look at the in and out of scope, which is good to have, it begs the question then where is the demand planning conversation to address the current state? Because people do care about their bottom line right now, and the price of insurance to that. And if it's not us, where is it happening so that people can connect to that and help move that forward?
Yeah, I think our group talked about two main points. One of them was really about, our focus on the entry level non-licensed workforce, but that this is really in a lot of ways an invisible workforce, that if we're talking about, community health workers, peer support specialists, or a lot of the behavioral health workforce, that we don't see those professionals in our state data. And so how do we know if we are doing a good job? How do we know if these investments are successful and if we're not seeing it in the data? And then the other thing that we talked about was our medium-term opportunity around career laddering. And then healthcare really looks different from the other consortiums that might be a medium-term opportunity in manufacturing or in technology. But then if you are focusing on career laddering in healthcare, to take someone who is maybe a peer support specialist and support them to get, a CUDC or to get their bachelor's degree, or if they have a bachelor's degree, to get their master's degree, then people they have families, they're paying, rent, they can't afford to take on student loan debt, and become students. And so it is a medium term thing to become a healthcare provider. And once you become a licensed healthcare provider, is the juice worth the squeeze? Like, what do you make? Is it worth it? And in manufacturing and technology, it might be, and is it in healthcare? So just to be real realistic about business.
I was gonna say anything, but I do think it's really important sometimes that we look at people's life and just second guess what they mean. Like one of the bullets was that we need to focus on building a diverse workforce for entry level jobs. And I just think we have to challenge that. We have a diverse workforce and entry level healthcare jobs. So CNAs are 36% people of color, and nurses are 18% people of color. Home care workers are probably 40% people of color, and many immigrants who speak different languages. And so the idea that we think that we need to build a diverse workforce is wrong. What we need to do is take that diverse workforce that exists and create a career ladder that moves them up the healthcare chain. And so I just think it's really important that we make sure we're looking at some of those things and just really second guessing that's right.
That's getting you answered, Amanda.
Thank you for saying that, Melissa. I absolutely agree. I think one of the things that resonates with our group here is number one, that we're all are in a position looking for workers. We're all at this table because we have shortages. The other piece is every time we talk about diversity, we don't define what and how we're going to address that. And you are correct. We have a diverse workforce, but are they matriculating into the advanced positions? That is the issue that we're having. And so who's at the table to help them move to the next level? And that's not an external question, that's an internal. Can we go back to our organizations, our business, our union representation, and say, hey, it is an issue we're having because who's at the table? That's a tough question.
we have a number of insights in our group, and I think, a big takeaway was just, again, with that concept of being up a ladder, that need to provide social and material supports for individuals, and that may include insurance, childcare, transportation, and housing. And he brought up the example of, the mental health care rural presence and rural, and evidence that providing housing in those settings actually will improve retention over the long haul. So just, you could think about kind of what it takes to overcome those barriers and help individuals getting into the next level of certification or just to stay in these roles.
Thank you. Yeah, and I wanted to just elevate that need to challenge our assumptions when I, summarize the survey. Sometimes we're filling out a survey and it's from what we know at the time. And so I welcome the challenge on the slides. Like that is the space to do that. Because if we aren't doing it, we're going to keep moving from the place of assumption and what we know at the time. So I just welcome that. I really welcome that in this space. That's why we're all here, is to challenge the data, challenge the assumption, and generate something new.
Thank you. So what I wanted to say, being the director of long-term care works at RISE, I have a partnership with SCIU. All of our employees are SCIU members. The thing that I'm learning, and I want to raise your level of awareness here, we have wraparound supports. So we can help them with childcare, we can help them with transportation, we can help them with a plethora of things. But what we cannot do without their help is to really look at how we work in this state. We can recruit, but can we retain? Right? As a training entity, what can I do when I'm partnering with employers? And some of the people that have been there for 20+ years, needed an attitude adjustment. Right? So I just want to raise this, like we can do all the things to make sure that we remove these barriers, but at the end of the day, they have to work in these places and they want to stay. But do you think you will stay when you're being a need? Do you think you will stay here as CNA and everybody thinks that nurses are, small GOD? I'm just speaking to what is classism in the workplace. That's what I'm seeing and what I'm experiencing. And when I get feedback from my CNA, they're telling me what they're experiencing. And we have some really good employers, but do they have opportunity for improvement? Absolutely.
No, I just wanted to, thank you for saying what you did. Patsy, we talked about how workplace culture really needs to change and, be more supportive, particularly for professionals of color. And then, I think another thing I also like to challenge, I know that the governor's office said no dead-end jobs, but the reality of healthcare is that there's sometimes no logical next steps. And so, we have to be really intentional about creating those, career pathways and ladders and lattices so that, there's so many people, in healthcare who want to stay, but just don't know how to take that next step. And so they need that, help and assistance.
We have maybe time for 2 more, and then I want you all to get up and take a break before we do our next.
The other thing our group just talked about a lot about retention. Talked a lot about retention, but we also talked about if the governor's office is saying that licensing and administrative policy is kind of out of scope for this group. But when you look at CNAs, LPNs, RNs, all fall under certain requirements, certain licenses, it's really hard to kind of open the doors and try to get really creative if at the end of the day we're still stuck to those licensing requirements. And same thing with credentialing of community colleges. We talked a lot about the nursing shortage, but the nursing shortage is because we don't have enough nurse educators, but that's because our educators have PhDs and the colleges want PhDs so that they can keep their credentialing. And so it's this cyclical process of going back to what what Maren said, we used to be so collaborative and we used to find waivers or ways to make things work. And now that we're out of COVID and we're not in a crisis mode anymore, now it's right back to here's all of the roadblocks. And so I hear what Rachel was saying, what the governor's office is saying, and OHA, I know participates in this to take that back to those things, but it's a lot more than OHA, it's OSBN, it's ODHS, it's all of these different entities that need to be sitting at the table when we are trying to be collaborative. Because at the end of the day, no matter what we figure out, there's gonna be some impact on licensing regulations.
Yeah, and I want to elevate, I'll send out the governor's office remarks, just thinking there is nuance and like the specific, out of scope. Bullet around an existing table. I don't think that locks us out of, we are gonna run into those barriers as we are getting into career battery and lattice opportunities. So we absolutely need to pay attention to that, but I just really appreciate that. Well, time for one more, then we're gonna break.
I just was gonna agree that I think one of the things we're sure of course has the capacity to work with top of the scope so that we make smart decisions about the solution. So we'll find behavioral health, a lot of administrative requirements that sometimes don't encourage that. And ensure that mental health has. So I think in that way, specifics of like employers to them to really place people at the highest level of their scope, therefore increase utilization of lower level credentials and entry level jobs. And I just want to really reiterate for DEIB that we get supervisors, we get wage incentives to support supervisors who are diverse and also and we not say entry level ladder up. The big discussion in our peer workforce is peers want to stay peers for their as their career. That is their career. And when we're recruiting diverse folks, we need to be careful not to repeat institutional ways of them through offering low wages. I think this is really important. That yeah, it's a lower level credential for this focus on lived experience and I think skills on top of it. But that is a critical part of team-based care. And that team member needs to really seriously think about how we value that. Like Cheryl said, you know, here's making $20 at the master level versus making $27, they threw $150,000 to debt. Is the juice worth the squeeze? No, it's not. So that's the system we're in. So I appreciate it.
Well, there's always unfinished conversations at this table, but wanted to give everyone the opportunity to take like a 5 to 10 minute break before we get into really focusing the rest of our time on the objective, which is advising on workforce grant funding. So when you come back, you're going to hear from a panel of grantees that are going to share their experience with the funding before we get into a short-term kind of funding exercise within small groups. So you have lots more kind of approach. So come back in about 5 minutes.
All right, everyone, we're going to go ahead and get started our panel of experts here this morning. So very briefly, my name is Barry Thomas, and I'm the program manager for Future Oregon. I work very heavily with all of the granting sides of investment in Consortia, Oregon, and I'm here to introduce and welcome 3 panelists who are going to be talking a little bit about their experience. 4 panelists, their experience working with grants in the healthcare space. So for my right, we have Patsy Richards, who's the director of long-term care works with entrepreneurship. Then we have Dave Fuller, who is the Dean of Instruction, Health and Public Service at Rowan Community College. And then further down, we have Ruth Alvier, who is a research director for Oregon Center for Nursing, and then Jim Video, who is the executive director for Oregon Center for Nursing. So we're gonna go ahead and we will start off introductions and the first question, and I'll start with Patsy. Can you tell us a little bit about your organization and its track record of connecting underrepresented populations to healthcare jobs? What are the successes and challenges of this?
Okay, I mentioned earlier that I have a labor management partnership with SEIU, the owner is the executive director of SEIU. And what we do is we have a trust, and through the trust, our SEIU members pay into the trust, and we can provide training opportunities. We have ordiners at the table, and we serve close to 46 skilled nursing facilities. What I'm most excited about is the opportunity to do things different. We can't keep doing the same thing and expecting different results. So this trust allows me to have conversations not about just recruitment, but retention. So we're bringing them to you, we're training them, you're excited about them, but then they're telling us it's hard for us to stay. So now we need to have a conversation. So how can I partner with you on the retention piece? And so we're excited about that. And then when we think about underrepresented, Melissa nailed it, she nailed it. We have 36% people of color coming into the entry level position as a CNA. So diversity is there. Now, about how are they matriculating? That's the challenge. That's the number one question. We talk a lot about DEI in this state more than, I came from Alabama, where people would whisper DEI. Right? But now I'm like, okay, now I'm looking for the tangible evidence that we're not really just talking it for long.
Thanks for having me here. I'm the dean of instruction. Community college. I've been there just for a year, but I'm excited to be here to really look at innovative ways that we can create opportunities and to expand our training capacity. Obviously, nursing is one of the areas, but across all the healthcare programs that we have in Southern Oregon, not just in rural. Lots of opportunity to include diverse populations in Southern Oregon. Over 40% of our students are first generation college students. We have economically disadvantaged students down there, a large percentage as well. We are one of the institution, one of our strategies in our plan for the next 7 years is to become a expanding serving institution. Which will expand levels and to counties that we serve Jackson, Joseph County. So we are super excited to look at innovative ways we can expand our training capacity and really help employee students and employee folks into those entry levels and the next steps along the career ladder, and with an eye on building systems that are able to include people in that process.
Let's skip over Rick for a second. My name is Janet, and I'm the executive director of the Emergency Room Nursing. And part of the reason why there's 2 of us on this panel is because both of us know that it's still on. I can talk really loud too.
Sure.
All right, thank you so much.
Again, my name is Janet, and I'm the executive director of the Oregon Nursing. And part of the reason there's 2 of us here is because there's one of us who can talk a lot about what the organization does, and the other one who can talk a lot about the project, this Future Ready Oregon grants that we received, and just the details of what this project was. So I'll start by telling you a little bit about our organization. We're a little bit different than a school or a training program. We're a nonprofit organization dedicated to really understanding the nursing workforce in the state of Oregon. We're more than 20 years old. We've been doing this for about 2 decades, specifically because when you talk about nursing and looking at all of the data that we saw about nursing today, you can see that nursing is one of those professions in healthcare. There's a lot of cycles. There's shortages, there's surplus. There's shortages, there's surplus. One of the things that we're very dedicated to is not only having that data and really understanding what the nursing workforce is like, but also having a better understanding of how can we stabilize the nursing workforce so that we don't have so many ups and downs. There's so many structures in healthcare.
be able to provide healthcare to the people. When we talk about working with underrepresented people and helping them get into their jobs, it's a really tough goal when it comes to nursing for exactly the same things that Patsy was saying. We do have a large number of people who are coming into these positions to a CNA level that in some cases absolutely mirror what the diversity or the ethnic and racial diversity of the state is. But once they get to the RN, it doesn't stay that way. So we've done some work trying to figure out what some of these causes are. What are the reasons why they don't make that jump? And some of them have to do with the individual and what they're working on, but some of them have to do with what the workplace is like. The microaggressions that are happening in the workplace are actually stopping people, not just people of color, but people of other diversity areas, you know, LGBTQ, all of those people that come from, that identify as in that category, or even when we're talking about nursing men, which is something that is really, it's something that it's really funny to say because a lot of people will say, well, we need to do things to promote women. Not in nursing, we need to do things that promote men. And so, and also figure out what are the microaggressions that happen against men in nursing that actually discourage them from these positions. So those are some of the things we've done. And now I'm gonna let Rick tell a little bit about our project, if that's okay, if that's appropriate. And we'll talk about the project in the third round.
Hi, everybody. I'm Rick Allgaier. I'm the research director at OCN. And here
Wonderful. And Rick, you guys can go and hold on to the microphone and we'll start at the end there. Tell us a little bit about partnerships. So partnerships you've developed in the communities you're working in, that are involved with the project, advance the diverse healthcare workforce, focusing in on what are some of the key components of the successful partnership.
The OCN has made in relation to this project or just in general? Okay, the partnerships that we have made overall is, you know, first of all, I think that in the work that OCN has done over the years to really advance DEI, we've started from a place about 10 years ago of really understanding cultural competence. I don't know that that necessarily is the terminology that's used anymore, but it really is that idea of how can we make sure that the nursing community can be culturally competent, not only with their patients, but with each other to really improve that workplace and make sure that we can get our nurses to a place where they can work together and they can get over any biases that they may have developed over their lifetime career or whatever. The partnerships that we've made, we have worked with several organizations that are dedicated to supporting nurses from different ethnic backgrounds, like the Alliance of Black Nurses Association of Oregon, AMNOW. And we've also done a lot of partnerships with the National Association of Hispanic Nurses. Could we do better? I think nursing could do better. And I think that one of the things that OCN needs to be really cognizant of, and what I try to be very cognizant of, is how do we make sure that those partnerships are strong so that we can keep that work going and also have it be at the forefront of the conversations that we have.
Thanks. I think from our perspective, probably the strongest thing that makes partnerships work well is there's alignment in your organizations and really identifying what that is and clarifying it so that we know exactly what space we're working together on. With respect to that, once that's determined, when you have specific projects, making sure that there is clarity in what that project is, when it ends, what the objectives are, right? And those will allow you to be successful and build upon those projects that you've worked on together collaboratively and to strengthen the partnership and move forward.
Yeah. This is surreal for me because when I came to the state of Oregon, when I was invited to a interview, I was in this very big room. And yes, and when I walked in, it was 15 people at the table. Was it not Elizabeth? It was, right? And I was like, this is my kind of work. It really was. And what I want to drive home here is nothing works for me, any one of us, unless we value partnership. And why unions and employers build labor management partnerships? 1, quality scalable programs for the workforce. 2, solve problems for employers, training, benefits, help recruit and retain, help recruit and retain, help recruit and retain. More worker control in their own lives and jobs. Workers are decision makers and board members, and for long-term care, trust funding model maximizes Medicaid match. You know, and after this, you can ask me about that, but what I really want to focus on is worker-centered. We have made everything one-sided in this country for far too long. Now we need some balance. We need some balance. And guess what happened during the pandemic? Did we not get some of that balance? When you tell them to go home, right? It's like, oh, you work for me. And then you started talking about how come back? Because these structures we put in place will not survive without you coming back to these areas because the grocery stores are struggling, right? The corner stores around the business, the coffee shops, they're not seeing the revenue that they won't once getting. But the workers are saying, hey, I don't mind coming a few days a week, but don't make me come in. That's called balance. And the labor management partnership that we are in with SEIU creates a level of balance, not just for our organization, not just for them, but for the employers as well. It's now time for us to see the whole picture, not just 1/3.
Thank you so much. So now with the third round, I'd love for everyone to share a little bit about the project you have funded under the workforce trade grants and talk a little bit about how the teacher ready funding helps meet a workforce need. What do you want the consortium at large to know as they develop recommendations that will inform future funding opportunities? Possible, go ahead and start with you.
Oh, one is we needed to create our curriculum in-house. We were working with a third-party vendor, and we were feeling like, you know, we were not getting all of our needs. And so we started a project, and we were told it would take about 2024 to complete the project. But then OSBN, where is Nicholas? OSBN came out with a new guideline, and we had to change our standards based on their requirements. And we went back to our curriculum team, and we were so glad that we got that grant. But guess what they showed us? We didn't have to wait till 2024 because we rolled out a new curriculum. No, we started this week. Did we not? Right? So it allowed us to respond to the OSBN needs, you know, when they needed it. And then the other piece of it that I really want to raise when we think about funding, we can't keep doing what we've always done. Where is the innovation? Now, if it's not broke, you don't need to fix it. But if I look under the layer, and you keep talking about diversity, but I look at your numbers and there is no diversity in the places where people are making more money, we need to talk. I shouldn't keep giving money to organizations to keep doing what they've always done and come in spaces and act like they're doing different.
And so, at Rural Community College, we received a grant for capacity building. So the scope of our work was really twofold. First, we were charged with creating the fully developed curriculum to begin a dental hygiene program. That's one of those programs. That's one of those programs you can't take a single student until you have a program accreditation, which if another layer creditors, that type of thing, part of this discussion, but it is a lengthy process. And part of what they want to see from the institution is dedicated financial support for the program. And the way that they look at it is that we have to have a person in place whose main role is the dental hygiene program administrator for at the time that we submit the application. So we first submitted the application before I started at Rural Community College. We resubmitted it during this process because they came back and said we didn't have a fully developed curriculum. 1,000 pages of curriculum later, we submitted that. We're still waiting. So all of this time, we have to pay a program administrator for a non-revenue generated program. Talk about barrier for underfunded community college. So part of that was the first part of that grant. The second part was really to convene with our industry partners in healthcare, manufacturing, and technology. And we got CEO level folks from those different levels at different meetings. And we talked about what are we missing in our portfolio? What's the next thing that needs to be, the next training program that needs to be here for Southern Oregon? In the healthcare realm, we heard, well, you need, number one, the first thing you need to expand our, because we take 32 students per year. And while we know that we retain most of the people in Southern Oregon who are trained there based on the longitudinal study, most recently, but also other data, we don't get enough, we don't feel the need, nobody does. It's the same problem everybody else has. What's unique to us down in Southern Oregon is we just can't get the clinical faculty, the adjunct faculty to help support this clinical training program. We can get the spaces, we just can't get the faculty because the pay is not there. Nurses don't want to work full-time for their job and then work part-time for 2 more days a week. That's a lot of work that creates burnout, it creates part of that retention problem that we've been talking about. And we can't guarantee the same rates of pay, right, that they're going to make in the industry. That's the same problem everybody has. So our problem is the clinical space, it's the actual people. Out of that meeting, we heard a couple things. We heard about the willingness of the CEOs from our top 3 partners, Asante, Providence, and La Clinica, that they want to do something to help us with that problem. And then we looked at the portfolio, and from the portfolio, what we found was that their top need was respiratory therapy. Their second need, well, one and one, they were a tie. The second one was, but for different reasons. The second one was rad tech. And the reason rad tech was elevated was because that was the most profitable segment at the hospitals. But respiratory therapy was their greatest need because there's no pipeline for that. And then the third was certified surgical tech. However, that one was lower because we do have a small pipeline in Southern Oregon already for partnership. So, with that information, some of the things that we started to act on was we went to West Campus. We asked for people to take 24 more students beginning this year, with the expectation that our partners are going to help us. Part of what we've done is we've created an MOU where we are working towards, it's not finalized yet, but it's almost finalized with Providence. We are working to share their nurses who have the required qualifications, and they're going to give them release time so that they can teach for us, they can keep their full-time job. So it's essentially an MOU. We still retain the rights to hire and fire those folks as instructors for us. The problem for Providence and Sunday, they're going to lose time on the floor for those folks, right? They're also going to lose funding. We will not pay more than what our CBA allows us to pay. So that means they're not going to get paid for the time that they're spent preparing for their clinical sessions, setting students at the end of those clinical sessions. However, Providence or Sunday will pay them for that time. So they're losing money there, they're losing time on the floor. So it is a burden for the hospitals. The need is so great to do that and take that in the short term for the long-term benefit. Having said all of that, we are interested in trying to find some funding for that gap and to help support our partners. That's kind of our next step is really trying to find that gap. And this team is relegated to just time on the floor. Other departments.
One of the things that we've been working on through this grant was, we've got a body of literature or body of work that we've been working on for a number of years. Because as David was mentioning, you know, we were created back in 2001 to deal with the nursing shortage then. And it seems like we go through this cycle, we have a shortage of surplus. And so what we're trying to do is understand how that works and why we've been working on it for so long, and we still see the cycles. So as we started digging through the data back in, started working on stuff 2018, we realized that if you're a hospital in the metro area, Portland, Eugene, one of the big metro areas, you don't really have too much of a problem with recruiting nurses, and most of the time the problem you run into is you're looking for specialty care, you're looking for people with lots of experience. But then when you start talking about people in, say, a hospital in the rural parts of the state or a non-hospital setting, yeah, a lot of those requirements don't apply. They just want somebody in those slots. And so what we realized early on was, you know, we have a maldistribution problem. It's not that we don't have enough nurses, we really don't know if we have enough or not. But what we do know is they're not spread evenly across state where we need them. They're also not within the practice settings in which we need them. So nursing homes, long-term care facilities, school health, some ambulatory care. Really hard time finding nurses and other settings stuff. So we've been really focusing the past couple of years on trying to deal with this and talk about this maldistribution problem as a way of changing the way we think about nursing shortage. And so we went out with the Office of Rural Health and some of the rural listening tours. We've had at OCN, we've had a couple sets of listening tours out in parts of the state, and we get drips and drabs of information. We hear about housing. We hear about the lack of housing. We hear about K-12 education being a barrier. We hear about a whole host of things. But what we don't ever hear is really a comprehensive picture of the barriers to being able to recruit and attract nurses, or the things that communities can use as an attractor to bring in nurses, or as we've talked a lot about, retaining their nurses. And we're going to really focus on retention, because if we retain nurses to the degree we want, we don't have to really recruit much anymore. Because you have workforce and it's there. Yeah, you have to replace for retirements, but we have 30% retirement turnover rates in some of our settings, which is really, really high. And so you're turning a third of your workforce over every year. That's really expensive and really difficult to do. So one of the things that this grant allowed us to do was go down to a small community, and we had a very good working relationship with the person in charge of the Workforce Investment Board, and talk to every practice setting. So we talked to ambulatory care, we talked to hospital, we talked to long-term care, we talked to public health, we talked to school nurses. I'm sure we forget someone, but we spent about 3 weeks in Tuesday just talking to employers about what is the barriers, what's causing problems in recruiting. I mean, we'll get into 2 different ways, because there's 2 different things. One is the practice setting. What is it about long-term care or school health or whatever that causes issues in recruiting and retaining? There's also what we call community issues, which have nothing to do with the practice, but it relates to community. How good are the schools? What's housing look like? What does economic opportunities for spouses and partners? Why would you come to this little town? We ask all those kinds of questions, and for this one little community, we have a pretty good picture of it. What really was interesting to us is we use this grant to help us develop this method to try to figure out how to get this big story. And as we talk to people, they got, unfortunately, more confusing. We were hoping it would be you know, Don and I would go down and we have, you know, a light bulb, and I'll say, this is the problem. The problem is every practice setting viewed the community a little differently. The hospitals, when they were talking about housing, they would say, yeah, there's no housing available. The other practice settings would say that long-term care and public health, oh, there's tons of housing around, it's just it's uninhabitable housing, but it's low quality housing, and so you're gonna have a hard time getting professionals. When we talk about other things like, you know, some of the organizations talk about the lack of big box schools, or how far you had to go. And one of the things that the only thing that they really were drawn together with when we talk about community attractors is like, why would someone come here? And most everybody said Coos Bay is actually a really kind of cool little town. And there's, if you're outdoorsy, there's tons of things to do down there. And they were pretty uniform also, those kinds of things. So if you are, and in fact, the hospital in Bandon, they have a world-class golf course in Bandon. And he said one of the things that we do is we recruit out of golf magazines. And we have been very successful with that. And so what we're trying to do is understand how can we enhance or show off the attractions that different parts of the state have. And how do we try to counter some of the barriers that we ran into? So we're in the final throes of the project. We are going to go down and talk to the folks in Coos to see if the data we collected and the way we analyzed it were something that's usable to them. And then next year, we're going to take this on the road and go to other communities. So we're definitely looking to form partnerships in other parts of the state. But it's a really interesting project in that it takes the work we've done for maldistribution, expands it into other things. So when we start talking about solutions, one of the things that we do for the community, I mean, for the practice phase, is talk about a concept of embeddedness. And we talked about people, I've heard people talk about how, you know, you need to get the employer to be connected into the workplace. That's really important to get people to stay. It's also really important to have people connected to it. Because that term of embeddedness not only applies to the workplace, it also applies to the community in which they
live. One thing that I thought was so amazing about the project that we were able to do, and just listening to Patsy and Dave and listening to their projects, I think we should remember, it is so awesome that Future Ready Oregon even exists for us to be able to pursue these things. What this project that OCN was able to do, this is stuff that we've been talking about for a really long time, but be able to go to a place and say, well, we really need to get some funding so that we can try to look at the community things. It's always like, well, then what are you asking for? Are you asking for money from a healthcare bucket? Are you asking for money for a housing bucket? Are you asking money from a community development bucket? And by doing this Future Ready Oregon grant and being able to look at it, we were able to do something that was truly innovative. Like even listening to Dave and just the idea of providing funding for nurse faculty, I don't know that was definitely something really difficult to do prior to this Future Ready grant opportunity. So if you are thinking to yourself, like, is this really making a difference? Yeah, we're actually starting to move in these directions that we've known for years that we needed to move because of this project and because of the work that we did.
All right, and Patsy would like to say something to wrap up.
I wanted to take a few minutes to talk about RISE partnership. We're in this building and we share it with SEIU. And I just wanted to touch on the fact that RISE partnership envisions an Oregon where all workers and the people they support are honored, valued, and empowered. So if you think about an umbrella, RISE is the umbrella, and they provide all these shared services for all the different 6 trusts that underwrite. So follow me, I'm gonna do it in 30 seconds. I hope you can keep up. One is CareWell benefits, and CareWell's supplemental benefits is 2. They provide benefits to the home care and personal support worker workforce. Then we have CareWell training. They provide training to that same workforce. Then we have the newest one, Essential Healthcare Worker Trust. Jenny Kapir. They provide benefits to the workforce that I work with, that I provide training opportunities to. And then we have the Oregon, which provide, education, how to access their benefits as state workers. Thank you so much.
Yeah, thank you to our panel.
I mean, we're late, but you know, these people, like, I think they will lead the examples and wanted to make paper questions if we have them while we're here. And just the example that was here was the one. So yeah, trying.
So Dave, the work that you're doing with your partners and understanding what's missing. That happening around the state.
That's a good question, I don't know.
So back to our general schools and how we better collaborate, when we give these grants, figure out a way to take that kind of fantastic, replicate that and spread that, so that's happening in every community. We did that, stick out part of the.
Yeah.
Yeah, so Heather was also gonna be here from Rural Workforce Partnership, and they have their own consortium. And so they have a healthcare consortium, with that local connection with business and education pathway is tremendous. And so I just wanted to elevate that, because they're doing incredible work down in road with partnerships and connections.
Can I touch on that real quickly? Like, we're trying to partner with some community colleges and we've run into some roadblocks for different reasons. Like, we're trying to do a LPN apprenticeship, but both colleges have an RN track. And they don't know how to separate the LPN from the RN. And we have RN staff that you can leverage the way that David's talking about. But because we don't have the opportunity present for us to walk into that, I'm gonna have to work with a third party.
Back to that slide, we're competing, we should be collaborating.
Yes.
And just to add to what Ryan said, in our small group before, we were talking about how do you leverage what happens in one grant, how to spread it. So maybe within our grant process, we could build in either asking them how they would spread it, or kind of set the expectation, or maybe give money for technical site that the grantee would provide technical assistance to other kind of similar organizations around the state, or just so it doesn't just stay with that organization.
Melissa.
Yeah, one idea that, I don't know if this is already happening, but just building off of that, it's like also like, do we ever take the opportunity to get grantees together to spend a day or two, like actually sharing their ideas and then figuring out where and how they collaborate as grantees too? And I think the piece of it, like there are just lots of buckets, but I think one of our challenges in this healthcare workforce is that buckets feel very separated, but there's actually easier ways to connect them if we put people, practitioners in a room trying to connect it. So that, like going back to your idea, I think you also maybe just put grantees in a room, spend a day sharing ideas and sharing their work. They could then think about how Dave could take some of the work Patsy's doing, or Patsy could then be like, oh, maybe Dave's the right partner for us, or maybe OCM is the right partner for us. So it's just like a way to think about it.
Thank you. We have time for one more, probably. We're already running a little bit.
And then to build off of what Chris and Melissa said, our Healthy Oregon Workforce Training Opportunities Grant Program, we started to do these small annual meetings, given our limited resources, and it would be great to think about doing it with the healthcare workforce grantees in workforce training, like maybe do some sort of shared convening, because our program so far since 2019 has made 34 grants and about $23 million. So, and a very wide range of different healthcare operations and issues.
Sarah, thank you. Absolutely.
It's more of an observation. Just Dave, how many students are you taking through that particular program?
So the second cohort that they will be in the spring, we are in
So I think this just goes back to the demand conversation, because let's just say the demand for that particular career path is 500 people, and we're only cranking out 32. That's the example. Then we're not really making a dent, and that's not to say that what's being done is good. I think what's missing is being able to connect all of these programs to the larger goal. You know, and be able to say they started to do that. I hear Pat is saying we have LPNs, and being able to paint that picture against demand and against how long it takes to get that 32 students out. And then the question for me is also, what are the metrics? Do we really retain those 32? So what if we could train them, but are they staying in Oregon? And is there something within what we're doing that has some level of a requirement, if you're going to get this kind of funding, to put that kind of training, so we don't have knowledge getting trained and walking out the door. So I think that while the work is good, I think it goes back to the bigger picture. What are we really solving for? Are all the programs handled, LPN and others? And how are you thinking that picture? And I think it was wonderful to hear your partnership with some of the employers. That's the kind of data I think that matters to the employer groups. Because they, you know, if they're gonna fund it, then somehow they need to hire them. Where's the skin in the game in that I think needs to be called out. And I think lastly is more what Rick was talking about as an opportunity, you know, getting that comprehensive picture of the barriers, because it's very contextualized to the community. So urban versus rural, and I think we've got to bifurcate this problem based on urban needs and maybe rural need and go a bit deeper, because the solution for urban are not going to be the solution for rural. So there has to be a better way, and this is the opportunity to paint this picture while we're celebrating the success. When I hear 32 and it is a success, it could be, you know, a diamond in the ocean, you know. So how do we ensure that all of these dollars are going to stay in the state?
So just wanted to thank our panelists for traveling here and providing your wisdom. So Brian is talking for much longer, don't worry, because we're gonna spend most of the afternoon in a small group discussion, but before that, bear with us as we set that up. I'm gonna bring my colleague Jennifer Porcello here, who's, of course, as you know, the director of Future Ready Oregon, and we're going to walk through, he's gonna walk through very quickly. In your package, you have and we heard this in the meeting in June, the requirements of the workforce ready grant funding that are in the bill. She's also going to go through the first round criteria, the second round criteria, and then right now we're going to be looking at a third round RFA, and our consortia is advising of that RFA. So she's going to share a little bit of that and try to tee up the smaller discussion. Good.
Thank you. And I'm going to move through this pretty quickly because we spent a bit of time on it at the last meeting, and you have materials in your packet. But we're going to go to the next slide. As a refresher, we have the best place to see them. As a refresher, the legislation outlines some basic criteria for the workforce ready grant funding. Opportunities must advance recruitment, retention, or career advancement for historically underserved and vulnerable communities. And the eligible entities for funding are community-based organizations and workforce service providers. We walked through the definitions for those last time we met, and I believe that information is in your packet with a little bit more detail from the legislative language. Next slide, please. Thanks. And then in terms of eligible activities, generally we talk about these and think about these in three buckets. One is curriculum development. that can be really specific, culturally and linguistically relevant, career pathways, credential and training programs, and the associated supports related to that. So technology needed, curriculum development itself, other materials and supplies associated with that. The second bucket is organizational capacity, particularly as we look to expand the partners that comprise our workforce system. In many cases, that might require organizational capacity supports. That could include, but is not limited to, hiring staff, equipment or technology, training related supplies, and other administrative costs. And then the third bucket is really related to those direct supports for individual participants. So that can include training and fee assistance, tuition and fee assistance. It can include paid work experiences. It can include wraparound supports, and really intended to come alongside that individual and support them through their education and training in whatever ways remove barriers for successful completion. Next slide, please. So we wanted to spend just a minute looking at the first couple of rounds of workforce ready grant funding. Round one built on the criteria established in the Future Ready Oregon legislation and really focused the initial general fund investment, which was $10 million on capacity building activities. We received 146 applications in that round, totaling $74 million, awarded 41 projects, totaling roughly $10 million. You heard from some of those grant recipients today. In total, 11 of the 41 projects specifically supported healthcare workforce development, and 14 additional projects, so 25 overall, included healthcare workforce development programming in some shape or form. In round two, which we're in the process of reviewing applications now and narrowing in on our decisions, which are expected later this month. But we can share with you that we did receive 165 applications for funding, totaling $251 billion. We have up to $35 million allocated for this round of funding. And we thought it would be helpful to see sort of across the landscape how many of those applications were related to healthcare. 81 of the 165 projects proposed are specific to healthcare. So healthcare related workforce development only, so roughly half of the applications, if my math is right, but totaling $130 million. And then I'll just note that that overall 120 of the project applications, so in math off the top of my head, I think that's roughly 2/3 of the applications include healthcare in some form. So there are general applications across healthcare, manufacturing, and technology. And as I mentioned, we anticipate making award announcements later this month. And so for the round three, again, round one focused on capacity building. I think I skipped over this. Round two really focuses on innovation in programming, advancing opportunities for recruitment, retention, and career advancement for historically underserved populations, building on collaborative partnerships like the foundation of the industry consortia that include industry partners, education and training partners, and community-based organizations. Round three, the additional criteria is to be informed by you all. So for healthcare, we would be looking to you all to provide direction for what additional criteria, building on the base criteria in the legislation. This could be one RFA, request for applications. You could also decide that you have
two different initiatives that we'd like to inform, but we do anticipate releasing the healthcare related request for applications in the spring of 2024, because those have to all be under contract by the end of 2024. Sarah. Is
So I just want to make sure that there's a little time for questions for Jennifer before I move to the small group discussion. So Chris.
So round one capacity building, round two. Please, did any sort of foundation, and sometimes we would have capacity building grants that would lead to the ability to apply to the implementation. There wasn't any contingency, right? But were there, like, were there any that applied for capacity to get them to the place where they can apply for the implementation? Like, is that a part of?
certainly part of the intention of the capacity building grants was that it would prepare them to apply for the second round of funding. That was not a requirement or a criteria.
Question for you.
A bunch of grants will be available for round 3 through $1
So the total dollar amount we anticipate will be about $40 million across all 3 consortium. So we're still making some decisions about what that means for healthcare manufacturing technology, but we have a balance of about $40 million to work with for study grants.
Yeah, okay. I just wanted, I think you brought up a really good point. I honestly said it about, about the continuation. So you give them the funding to build the capacity, and then there's not an ability for them to give them the second round to see if it actually worked. So I just want to raise that. I want to raise that to this group that we need to think about. If you're going to give somebody the capacity to apply for the next round, and then tell them, okay, now figure it out when you get there. Let's think about that.
There's another question here. Or we lost the I don't know when they might go. Okay.
It's along that line of process question is, I'm curious, I think more about the next report to different foundations and some other things. Is there a formalized way or thought process in the grants and working with the grantees or lifting up potential policy or systemic organizational barriers to do improvement? Because that would be my hope, because a lot of the things I hear from the panelists that are really great is this is kind of one-time money, but they're really identifying things that resonate more issues in the behavioral health sector that are really about policy.
I appreciate the question. I think the intention for the industry consortia is that each healthcare manufacturing technology, part of the work that we're doing is learning together, learning from grant recipients, learning from you all as industry experts to inform where are those policy barriers, where are their funding barriers. And I think as you all have started your work, identifying what are problems that can be solved with funding and what are problems that need to be solved. There is, so Heather asked if there will be a formal report. So we do have an annual report due to the legislature and the governor's office. The first year's report that was published in December of last year focused largely on the process, the standing up of the future ready learning programs. The report that's due to the governor's office and the legislature in the next couple of months starts to dive a bit more deeply into what are the impacts, outcomes, and lessons learned.
And I just want to name that you're getting into some of the small group discussion items. This is a panel that of course does not include every perspective of future working grantees and every single community in here. But we selected that also because we were naming some of the known kind of global barriers that we could think about as we advance our short-term objectives, but that is not the only opportunity. So as we go through a small group discussion, name what information is missing that will help us make better decisions about this short-term funding. So I think there were a couple other questions before I tee up this small group activity. I do want you to spend at least 30 minutes in this activity. So I'll have Jennifer walking around to the small groups to answer questions, but I want to leave space for the one additional question that we did. Was there another question?
One of the things that we talked about in future already was the procurement process. Have you seen improvement in that? Because I know, for some people I've heard, you apply and 6-7 months later, you actually get your money. But there is an opportunity for improvement. So, you expect as you walk through this, you'll be looking at lessons learned and how to improve the next round. So just that was the question.
Absolutely, and I don't know if we have time to talk about process improvements now, but we can certainly maybe set time aside in the next agenda for process improvements and lessons learned, but we've definitely been looking both at what are we learning about how to make grants more accessible and what supports are necessary in that process, and what are our processes and practices as a state that need evaluation. We've definitely been informing that across the enterprise. So would love to talk more about that, but also want to give it sufficient time.
Thanks, Jennifer. So I'm going to pivot to the small group activity, which is really diving into some of the information Jennifer shared, but also to start to generate guidance for the funding working group. So you heard a lot of information today about some alignment in the survey. I love that you push back because we obviously need additional perspective and voices and some of the data. You heard from the FAL and some of the data around demand and what we know and what we think about when we think about demand planning. That also includes some of the, perspectives on the supply side for education and training capacity. So in small groups, and so the exercise I'm going to tee up is in small groups, you're going to have an executive team member be leading a group. And so I'm going to count you off by 4. We have an executive team leader that left, so I will take that spot to break out into 4 groups. And what you're going to do is in your packet, you have instructions. That also includes the detail around the workforce ready grant funding criteria. Jennifer went over this very briefly because you heard a more detailed presentation in June, but also just want to keep in mind the criteria, what can funding be used for, what it cannot be used for. That is on the second page. The first page is your instructions. So there are 3 kind of activities or discussion points in your small groups. The first is and I'm going to go through the suggested criteria in a second. First is from this list of criteria that's also in your packet that I will go through on a slide, you're going to generate additional criteria for the group to consider. So I took the survey, I took the data and generated a list of suggested criteria that you can work from. But I want you all to back against that criteria. I want you to add to that criteria. I want you to generate ideas around additional criteria that we might advance forward to the funding working group. We're not making decisions today, but we want to get a sense of the criteria that we want the funding working group to unpack. The second is you're going to elevate priorities from the list. That includes the additional criteria that you as a group have come up with. And I want you to elevate 3 from that list that the funding group should focus on. This doesn't mean additional criteria won't be considered when you elevate these. It just gives us a sense of where this group's at in terms of priorities. Then I want you to ID additional information. So Heather was raising like, well, what do we need to know additional information around future ready working grantees. So I want you to identify what additional information should this funding group look at as they're making decisions over the fall. So with that in mind, I'm going to quickly go through, these are the criteria, suggested, these are not final, but I took the survey data and I took the, some of the employment demand data and created some options for us to look at. Now, your job is to add to this list, to prioritize this list, to add nuance. The funding working group will be building these options out. In addition to some of the criteria that you generate in your small groups. But there are cross-occupation ideas, so recruitment specific, community research, curriculum design, paid work experience, earn and learn, career advancement, and then there's occupation specific criteria. These were from surveys, so they do focus on entry level credential, short-term credential and non-certification occupations or non-licensed occupations. But this is where we're going to start. And it's your job to add and subtract and do all of this. Next slide. And this is also in your pack. So the questions I want you all to wrestle with in a group is what jumps out to you as an early win. So where could investment create momentum as a group and give us the most impact? So that's something I want to like. What is going to give us an early win? Which of this criteria currently faces the largest funding gap? And how do we ensure the investment doesn't duplicate other funding efforts? So, and third is if the RFA focuses on a specific occupation or family occupations, how can that investment support career lattice and advancement opportunities? So again, I'm sticking with the idea that we really want to move these entry and mid-level occupations into longer-term credential occupations. So how do we not lock folks into those short-term opportunities? So then, does the investment support a specific industry identified need? And if unsure, how do we get this feedback from industry partners? And then, does that investment help identify or remove barriers for priority evaluations? So these are the 5 questions that I all want you to think about as you're moving through the 3 exercises. The first being generating criteria from the list. So what's missing? The second is prioritizing. We've got to start to advance some priorities as a group. And then the third is what information is missing. And this is going to guide our funding working group, which I'm going to ask you all to sign up the end of this. So Janet is going to get 1. Brandon's going to get 2. I will get 3. And Melissa will be number 4. So I'm going to, now everyone is in a very obscure place. So I'm going to do my best. Remember your number. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 3, 4. 1. Okay, everyone, did I miss anyone that's on the consortium? Let me shoot. Dance too. Wonderful. So ones are going to come here. 2s are going to go over there. 3s are going to come back over here by Ryan. 4s are back here. Okay, so we are going to spend a couple minutes before I do a quick wrap up, sharing each either executive team member or facilitator of either mouth one is going to share 1 highlight from the additional criteria and priority setting discussion. Okay. Yes.
We have an advantage to get white.
Teach.
I don't
know if we could do one, but I will highlight. So we added to the district criteria, we added communication and retention. And the communication was really more around, you know, I use this example, my kids are going to college, but they've never understood what the healthcare professions are. And this is from grade school. Everything that is talked about is always just nursing. Nobody talks about tech, you know, and you've got a kid, my son is in engineering, doesn't even know what a healthcare IT or tech job is like. And so that's one, just communicating the crisis, communicating the need, and it's a big deal, and then retention is self-explanatory, those are just factors. But the bigger piece that I want to call out, issues and suggestions. It feels like the timing of grants is inadequate right now to kind of effectively show the impact of sustainability. So that was called out. So if the grant is approved in June and you're supposed to deliver by December, that's a 6-month runway. For the kind of stuff we're trying to do on capacity building, I think that needs to be looked at. The other one was, why are we not considering the RFAs from round 1 and 2 that were denied before accepting proposals in round 3? Because people took a lot of time, it's labor intensive, and they were thoughtful about what they were submitting, and I don't think that we want to have people go back and do another labor intensive round. Why not go back and look at that and figure out if this needs to elevate, especially the budgets that matter. The other call out is the selection and evaluation. I think there's a whole lot of process issues that got called out. One of them is, what's the sustainability of existing grants? So that's criteria. If something fails, you turn it off. Scalability, interdependence, collaboration, integration, innovation. Why are we not thinking about how to scale? So, yeah, and good points on the current grantees, and we'll have some responses on how, you know, you've already submitted an application, you might be able to repurpose some of that for another one. So I'm going to share the. Oh, that's good.
We just have some duplication, and so I think that just helps to reinforce. So, I think I'll put Melissa over here, and our group had some very similar themes. We talked about prioritizing programs that can be replicated and demonstrate some amount of learning. What are we going to learn from this investment? And we also talked about financial sustainability projects that prioritizing projects that demonstrate a sustainability commitment by the partners. Maybe that's through an urban learn model or offsetting supervisor salary, but something that demonstrates that a project is really understanding that this is a one-time investment and they have a plan beyond that. We also expanded recruitment and to include retention, that projects had to include both. I'm here to see something, but you said one, and so I just wanted to reinforce some of those things. And then I just want to I'll take the privilege of the microphone really quick to just address one point that Ms. Crew commented on. The funding has to be under contract by the end of 2024. Our funding doesn't have to be spent until the end of 2026. So it's a 6-month runway to get under contract, but the project activity is out 2 years. Okay.
Thank you, and I'll go in and Maria can wrap us up, because I want to keep us on time. Might be prudently, and everyone will eat after this, I promise. So our group, Duncan and Becky and the OHA folks may have transitioned, but the folks in our group, we really were excited to prioritize the early and entry and mid-level non-licensed short-term credentials of like the criteria, because the other RFAs didn't necessarily articulate that as a criteria. So articulating that, but making sure we're mindful on recruitment, retention, and career advancement within that ecosystem. So not just walking us into thinking around recruitment into those occupations and kind of describing what occupations like would live within that. Did I miss something? And that's what I can highlight. So it's very discussion. So we're in there.
Yeah, if you have a similar.
Solve the world's problems.
No, I don't. Next part, we can see.
Yeah.
Yeah, no, we have a lot of reason for comments. That should, collaboration. That's easy to do intentional with partners, but also engaging employers in a way that's more positive, more focused, and more intentional. And what are the easy part of the process? They're not. I mean, there's a big disconnect there. And how do we invest more resources to get them engaged? Because there's room to solving these issues with them. I'm just getting really looking about that. It's kind of like resources with the long term. Pipeline development of the labor farm. Are there going to be anything else? Please take the chance to look at that. Anybody want to talk about it? Oh, sure. And definitely, you know, learning the governability is part of our focus, but also knowledge. And then, you know, working in a way that is policy.
Thank you, folks. Well, I kept you a minute late. We're gonna do like 60 seconds of wrap up. I'm gonna send an email. You're gonna send for the funding working group if you'd like to join. So we are going to build this our day out further. Based on the feedback. So you'll get the notes, you'll get the kind of summary of our working groups, and you'll get the opportunity to sign up. In the back are box lunches, so I did not leave you all hungry. So please stay if you have time, just to get to know each other better and with us, with our staff, with each other. But if you can't, grab a lunch and leave. So they're at the back table, but I just wanted to extend gratitude and appreciation for the energy today. Thank you. Yeah, I thank you.